Good afternoon, everybody. Sorry to keep you waiting there. We've been having some slight technical difficulties, more of which a bit later. So my name's Nicky Cullum. I am Professor of Nursing at the University of Manchester and Director of the NIHR ARC, Applied Research Collaboration for Greater Manchester. It gives me great pleasure to welcome you all to this latest in the MAHSC Seminar Series, where we're showcasing some of our work in healthy ageing. We're really pleased to bring to you Professor Todd this afternoon. Chris is Professor of Primary Care and Community Health at the University of Manchester. He directs the NIHR Policy Research Unit for Older People and Frailty, and he also leads the Healthy Ageing theme of our Applied Research Collaboration. So he's going to start this afternoon off talking about how we help older people to stay active during the COVID-19 lockdown. And then he's going to pass over the baton to Dr. Annemarie Money, who is a research fellow also in the Applied Research Collaboration. So as I say, you're all very welcome. We really encourage you to participate actively in this seminar. So as questions occur to you, please type your questions into the chat box and we'll come to them at the end. And if there's time, we'll welcome questions orally at the end as well. And in the meantime, whilst the talks are going on, if you could all mute your microphones, please, and switch your videos off. And there is also an email address for any questions you might have if you can't use the chat function, which is mahscseminars@healthinnovationmanchester.com. So without further ado, I'm going to hand over the floor to Professor Todd. Chris.
Thanks very much, Nicky. Jane, could you stop sharing, because I can't share while you're sharing, so I can't share my screen to show my slides?
Yeah, that's done. It's ready for you now.
Okay, thank you. I'm hoping people can see. Could someone confirm whether or not they can see?
You are sharing screen, but we can't see your slides right now. So
okay.
PowerPoint up, I think.
Yeah, that was set up to go straight in. That should be it.
On now.
Okay, thanks very much, everyone. I'm going to talk for a few minutes about helping older people to stay active during the COVID-19 lockdowns that we've just experienced. And then Annemarie will be following on that, and she'll be giving us a talk about some other work we've done within the ARC. Before I say too much, I've got no conflicts of interest, I don't think. We've been funded by a number of people to do this work. What I say is my opinion, not the opinion of the NIHR necessarily, or the NHS or anybody else. And the other thing is that this work couldn't have happened without the fantastic support of the research team in the Healthy Ageing Research Group. I'll introduce you to them at the end. Hardly need to remind anyone that we went through a series of lockdowns last year and this year, starting in March last year, March till, when was it, mid-June, and then from, gosh, what were the dates? September, I think we went into local lockdowns, and then there were full lockdowns in November to December, and then there was another national lockdown in January until fairly recently. So all of that is likely to have had some kind of influence on older people. Many older people have been shielding, they've been staying at home, they haven't been getting out and about. Even though we've got mass vaccination and restrictions lifted now, there's still few activity opportunities available to older people. A survey that we did on behalf of Public Health England's National Fall Prevention Coordination Group, we're calling it a snapshot because we had a rather poor response rate, but nonetheless, we found that between, depending upon the sort of service, between 25% and 66% of full services closed down. Many of them moved to online only offers or some kind of hybrid offers. The ones that tended to stay open were the ones that were hospital-based and seeing patients in hospital and preparing them for discharge. Why all this is important for older people is activity restriction results in increased risk of falls by contributing to deconditioning and functional loss, to say nothing of the other health and social benefits. So being active is good for the heart, good for the mental health. Basically, it's one of the Phillips, I suppose, might say, it's by being active, you are likely to stay healthy. The accepted view at the moment is that the COVID lockdowns are going to give us a deconditioning and rehabilitation pandemic of their own, that many survivors of COVID-19, especially those with COVID, long COVID, are going to need help in reconditioning and rehabilitation. Many people have been potentially deconditioned because of movement restrictions. Those who have become deconditioned some have become deconditioned because of an inability to access healthcare, they've got sicker, and many people with pre-existing conditions, as well as the new COVID illnesses, may have progressed. So we think there's potentially a big problem. In fact, a few minutes ago, I saw some new data from Public Health England, which reinforces this. What did we think of doing in the Healthy Aging Research Group? Because we thought right from the beginning, older people are going to be staying at home. Is there something we as a research group can do to help people to stay more active? And the first thing we tried to do was the Standing Taller study. This study was an implementation study being run through the ARC, through the Applied Research Collaboration, of an app which is delivered on tablet, normally iPad, which helps people do balance exercise and other exercises which will reduce or should reduce falls. Last March, we were absolutely ready to go. Our first sites had joined up at the end of 2019. In fact, we had a couple of names of people who were saying, yes, as soon as we can, we would like to join your study. So come March, we just got the ethics approvals in March 2020. So not last March, in March 2020, we just got the ethics approvals. And of course, COVID hit. So the first thing I thought was, well, let's try and make this a COVID-friendly piece of technology and reduce all the face-to-face contact with older people so that the whole thing can be delivered digitally. First thing then, of course, we have to do is we have to get ethics approval of the amendment to only do this digitally and not meet people face-to-face. That took us from March to May 2020 to get the ethics okay. That seemed a little long, but you know, that's how things are. Then we have to go to NHS trusts to get local governance arrangements set up so that we could run the study through the NHS trust. Actually, we had a number of places which were not NHS trusts, and they were able to start more or less straight away. Relatively small numbers came through those non-NHS routes, but we were able to start them as of May last year. The NHS trusts, because of the governance arrangements to have for patients to come into a study like this, took until October, November last year before people started to come in from the trust. Some of the trusts have done very well and have started really recruiting people to take part in this study of implementation of this app. One of our bigger sites, a year later, we're still, well, actually a year and a half almost later, we're still waiting for the governance to be sorted out. So I think the lesson I want to just mention here is that we do have to find much more agile ways of responding so that something like this, which could potentially be useful for older people at home, could have been implemented much quicker last year. I can't tell you the results of this yet because we are still in the midst of doing this study. The next thing that we did about keeping people active was, as I direct the policy research unit for older people and frailty, we talked with the Department of Health and they were interested in us producing a briefing, a short overview, which could be used for policy people in the Department of Health, including the Minister, to say, what do we know about strength and balance or activity promotion amongst older people using digital means? And for this short briefing, we did two reviews of the literature rapid reviews of the literature, which have since been published, but they were in a pre-published state. We sent that off to the Department of Health. The first of these reviews is what we call a review of reviews. So what we did was we looked at what reviews of e-health and m-health delivery of exercise already exist. And we then brought those reviews together so that we could give a complete overview of what's the state of play and what we understand about using digital health techniques, either called e-health for electronic health or m-health for mobile health, digital health techniques to deliver activity promotion to older people. Our initial search of the literature found 743 papers. We found a couple of other papers using looking at reference lists. After we'd removed the duplicates, we only had 472 papers. We screened those by title and abstract and rejected 457 papers for one reason or another, which meant that we had 15 papers that we looked at really carefully to see if they would give us insight into the utility of using e-health and m-health techniques to promote activity amongst older people. And we ended up with 5 reviews actually included on assessing the quality of the reviews. So we actually have to look at the review, see how well done is this review. We had to reject one of those reviews in terms of its quality. So really we're based on 4 reviews. Cutting straight to the chase about what did we find? We found that there's generally evidence that mobile phone and smartphone apps appear to be accepted by older people and acceptable for older people, which I think was very good to hear, because lots of people say, older people, they don't use apps, they're not interested in them. But the evidence seems to be that they are acceptable. It was quite clear that older people appear to adhere to the apps, so use the apps, at least in the short term. By short term is normally about 3 months. The apps appear to be effective. That means they worked in decreasing sedentary time. So the amount of time people spent sitting around was decreased by using an app. They also increased their amount of physical activity and their physical fitness, at least over 3 to 6 months. Apps that were theory-based, that had behavior change techniques embedded into the app with clear instructions and connection to social and professional support, were more effective than those that didn't. Apps needed to provide exercise and activity interventions that fit with older people's lifestyles and expectations. And they need to be tailored so that the older person can say, this is what I would like to do, and these are my preferences, and this is my level of ability. What we call game framing is absolutely crucial. Everything has to be in positive terms. There's no point saying to people, you should do this, or you will fall, or you will have something bad happen to you. It's always best to put the messages in positive terms. By doing these exercises, you'll be able to spend more time with grandchildren, or whatever might be the sort of thing that an older person would find motivating. Lots of older people appreciated the benefits that they would gain from using an app, but those benefits had to be in accord with their own lifestyle and aspirations. So an example, like I just used, of being able to spend more time playing with grandchildren was something that quite often came through. Emphasizing that these apps or being active will help them stay independent is important for many older people. So there was very positive messages overall that apps can work with older people if they're properly designed. But, and it's an important but, there has to be a recognition that for many older people who are not used to using these technologies, there was actually a really steep learning curve, which has got to be both recognized and supported so that we help older people as they learn to use the technology. So generally, the evidence seemed to be in favor that apps can work to promote activity amongst older people. So the next question then would be, what apps? There are lots of them out there. What apps would we recommend? So we did another piece of work where we looked at all the apps that are out there on the various app stores, on the Apple App Store, the Google Play App Store. And we looked at the apps that purported to be about physical activity promotion strength and balance type exercises for fall prevention, those sorts of things. And we searched the App Store between November 2019 and February 2020. And we identified more than 7,500 apps that purport to be about promotion for, well, not necessarily for older people. We then reduced that down rather rapidly to a mere 20 apps, because it was quite clear from looking at the screening of their title and the description on the app stores that the other ones were not suitable. We actually updated our searches in May and got a couple more apps to put in. And then we looked at the apps that we had, which were 23 of them, which we downloaded them and we assessed them for eligibility. So we looked really carefully at what the apps did, who they were aimed at, and did an evaluation of them. We had the apps evaluated by using a couple of standardized tools and by involving other people not involved in the research team, older people and people who were sort of naive to the issues that we were looking at, to look at these apps, 12 of them. We got a couple of other apps by looking at what was in the research literature of apps that would appear to work. And we came out with just one app that came all the way through to being added to our evaluation. So we had 13 apps. We also looked at websites, and we thought that maybe information about how to prevent falls, how to improve your activity levels and strength and balance on websites. And so we did much the same thing using Google as a search engine, and came down eventually to 24 websites, which we kept in our analysis, which were purporting to give advice to older people on strength and balance and exercise for fall prevention. In the end, we evaluated 4 apps, and we have 4, from our evaluation, we have 4 apps that we would say actually do what they say they would do on the tin and are evidence-based and useful for older people. So the currently available ones earlier this year were the Otago exercise program, an app which delivers an exercise program called Otago, which has been shown repeatedly to be reduced falls and activity amongst older people. There's one called the Nimble Balance Program, which we identified, unfortunately became clear that whilst it fulfilled a lot of our criteria, that there was a good underlying evidence base and that it used behavioral change techniques, and that our evaluators, our independent evaluators, evaluated it well, that we couldn't download it in the UK. Actually, you could download it in Ireland, but not in the UK. And then there's the Keep On, Keep Up app that also did very well, and so would be recommended for use. And that one's been developed here in the University of Manchester by colleagues in our group, but this was the evaluation was done sort of independently of those people. The other app that came up well was the Standing Tall app that I mentioned earlier on. At the time, there wasn't an evidence base demonstrating that it actually worked. There's since been a paper in the BMJ showing that at 2 years, you do get a good effect. We also identified a series of websites. I leave that list up. These websites were assessed in similar sorts of way. Do they fulfill what are called the Health on the Net on code? So do they fulfill those codes? Are they useful? And do they present evidence-based information? And the Chartered Society of Physiotherapy website, FallsAssistant.org website, Go for Life website in the States, NHS UK's Live Well website did well, Profound EU website did well, Better Health While Aging Net did well, and this Caring Senior Service also did well. We also would commend people to look at a website called laterlifetraining.co, who have a lot of resources, all evidence-based. So out of those millions and millions, tens of thousands of websites out there, these would be the ones that actually deliver evidence-based information. So our conclusions, quickly, would be that digital delivery is better than no delivery at all. This is a rapidly changing area, and so that's why I've been so clear in telling you the dates, because things can change really quickly. New websites come, new apps come. In the longer term, it would seem to us that the digital will become very common, and we need to be careful in the way we think about how this is rolled out in the future. A really important issue is that we must ensure that apps and websites, all these digital facilities, are co-developed with older people to make sure that older people actually find them useful and that they are aimed at older people and fulfill their needs. I think for the immediate future, the way forward would be for those already familiar with using strength and balance, have been previously assessed and screened, moving them onto something like an app is probably a good idea. Those people who are relatively healthy and digitally literate could also be moved on with remote setup. They might be younger older people normally. And then rehabilitation following hospital discharge can be done with face-to-face setup, and that was clearly a recommendation. There is a huge issue, which I'm going to call MB or caveat. It's a real problem. That is the issue of digital exclusion and the exacerbation of health inequalities. We already know that older people, women, those from more deprived areas of the country or of our city, those people from Black and minority ethnic groups, and those from other marginalized groups are much more likely to be digitally excluded. And so if they cannot access these digital resources, then the health inequalities will become wider. And that's a very important point, especially in the light of today's Marmot report on Greater Manchester. So were we successful? These are data from Luke Mumford and Jack Elliott in the ARC, where we analysed the national data, so not just Greater Manchester, the national data on activity, which came from a survey called Understanding Society, the UK Household Longitudinal Survey. And what we notice is that at lockdown, so April 2020, there is a reduction in the number of days people over the age of 65 reported walking. It came up a bit in September, but it remains below the levels of previous years. If we look at the number of days people walked by where they came from the deprivation, using a statistic called the Index of Multiple Deprivation based on postcode, those people from the most deprived parts of the country had the biggest drop in the number of days walked. So they were much more likely to become inactive than those people with more resources from least deprived areas. So thank you very much for listening. None of this work could have been possible without a fabulous research group who made much of this happen. So thank you, and I'll hand over to Annemarie, who's going to give us some more. I better stop sharing. It's got awfully quiet, and I don't know how to get back.
Okay, I'll just try and share my screen.
I think I've turned off share content. Yeah.
Thanks, Chris. I thought that was great. Yeah, we'll move straight on to Annemarie, and then we'll take all the questions together at the end. Thanks.
Okay. Can you see the screen?
Yep.
Okay. So yeah, I'm Annemarie Money, and I'm a research fellow in the Healthy Aging theme at the Applied Research Collaboration. And I've been asked to talk to you today about the Keeping Well at Home campaign, which is a project led from the University of Manchester side by Jane McDermott from the Policy Research Unit and the Healthy Aging Research Group. And I think Jane is here on the call today in case we need any detail or clarification, especially about the early stages of the project, because the ARC became involved in the middle of 2020, mainly to undertake an evaluation of the project. So I'll do my best to summarise, but Jane's here if you have any specific questions that I can't answer. Okay, so if we think back to March 2020 and the start of lockdown, and the advice from the government for all of those people aged over 70 or those classed as clinically vulnerable was to shield or self-isolate to protect themselves from coronavirus and also to protect the NHS. So, as Chris said, almost immediately, all activity for this older age group was brought to a halt, and many now found themselves stuck at home, often on their own, many in inadequate housing with little or no outside space. In addition to this, in the early days of the first wave, the government relied heavily on digital communication to provide information to the public, and we know that this can exclude large proportions of older adults who they're one of the groups with the least access to or experience of using the internet. And in Greater Manchester, we know that there's a large proportion of the population over the age of 65 who are digitally excluded. It's been estimated to be around 100,000 people over the age of 65. So many older people were relying on the news for information on what they could and couldn't do. And this was sometimes confusing and it was changing frequently. So around this time, from the very early point, first point in the pandemic, the Greater Manchester Combined Authority Ageing Hub started weekly meetings with key ageing stakeholders in Greater Manchester in order to share insight from the different areas and the different ageing organisations, really to try and understand how older people were feeling about the lockdown and the restrictions, and also to work together to make sure that whatever they could be done to help older adults during this time was done. So Jane has given me this slide which kind of gives you a sense of the breadth of the ecosystem involved in the Greater Manchester Ageing Hub meetings. So during these early meetings, feedback to the hub from older people and organisations aligned to older people found that they were often feeling alone, feeling confused, they were worried, and they were also feeling overlooked with the reliance on digital by default communication approach. There was also national concerns around the impact of falls and, as Chris was mentioning, deconditioning for many older adults, as well as concerns around mental health, nutrition and hydration and so on. So a key group in this ecosystem and the development of the Keeping Well at Home campaign was the Greater Manchester Older People's Network. And their involvement from the start allowed the Ageing Hub to make sure that they were listening to the voices of older people in Greater Manchester. And given how the information was coming to them that older adults were feeling confused, worried and neglected, it was decided that Greater Manchester needed to act quickly to provide a resource for older adults in Greater Manchester who might be potentially digitally excluded. So the Keeping Well at Home booklet was produced, and this was a booklet that contained practical information on a number of topics, including home exercises, nutrition and hydration, mental well-being, staying connected to others, advice on falls and how to get up off the floor if you've fallen, as well as local contact numbers for local authority community ageing hubs. And the booklet sections were evidence-based, and it was really important to the older people contributing to the booklet that the emphasis needed to be shifted to what older people could do to stay active and healthy during lockdown rather than what they couldn't do. So within a matter of weeks, Jane and the Ageing Hub team produced the booklets, which were then distributed in Greater Manchester via local ageing hubs, community groups, voluntary primary care teams and so on. So this just gives you an idea of the impact up to around August last year, and it was a huge success. 66,000 copies were delivered to older adults across Greater Manchester, with a further 12,000 digital downloads. And in addition to the local version that was produced, a national version was also made available, which could be adapted for particular areas. And this was done in a number of regions in the UK, and it was also done in Canada and Australia. The Keeping Well at Home campaign was also featured by the World Health Organization as a case study of best practice in terms of an age-friendly response during the pandemic. So overall, an extremely successful campaign and an example of how those trusted relationships established over many years with key ageing organisations in Greater Manchester came together to produce a resource for its older adults during a time of national need. But Jane and the team didn't stop there. They wanted to know, did the booklet work? Was it as successful as they thought it was? Did the older adults who received the booklet read it? Did they find the advice helpful? Did they actually try the exercises, or did the booklet end up in the recycling bin? So in August, the Healthy Ageing team at the ARC were asked to undertake an evaluation of the project of the booklet. So specifically, we were asked to understand whether the content of the booklet was useful to those who received it, if there were any topics that were missing and would be useful to include in future versions, whether recipients had access to the internet and how they used the internet, and also what was the preferred mode of delivery for receiving health and wellbeing information. So at that time, there were still restrictions on movement and physical distancing remained in place. So it was agreed with the stakeholders that we would send out a postal questionnaire to a sample of older adults in Greater Manchester who had originally received the booklet, and a digital version was also produced for the stakeholders. Okay, so the team spent a couple of weeks stuffing questionnaires into envelopes, and we posted out just short of 5,000 questionnaires to older adults in Greater Manchester who, as I said, originally received the Keeping Well at Home booklet. And we received around about 500 returned questionnaires, so about a 10% response rate. And the response that we did get was overwhelmingly positive. 92% of the respondents agreed that the information was helpful in the booklet. And then in terms of specific content, 90% agreed that the booklet would help older people stay healthy and active during lockdown. Around about 74% of the respondents had used the home exercises sections, and 3/4 found the tips for keeping their mind well, found them very helpful. Around half of the respondents did not have access to the internet. And then if we look at this a little closer, then the older respondents, the oldest old, were the group with the least access to the internet. We also asked the respondents to tell us how they preferred to receive health and wellbeing information, and 92% of them said that they preferred paper-based information sent to the home. So only 6% of them said that they would prefer to receive a digital copy. And if we look at this just for the half of the respondents who were digitally engaged, then still 83% of them said that they preferred to receive paper-based information over digital versions. Nearly 2/3 of the respondents said that they would not have had access to this information if they hadn't received the booklet through the post. And the majority of the respondents felt that the quotes and the case studies from the older people, they found them very reassuring. So we received quite a lot of positive feedback on many aspects of the booklet. I've just put in a couple of quotes there related to the exercise section. So you can see that they were very impressed with the fact that the exercises were the same as they were doing in physio, and also how they had recommended the booklet to others, to friends and family. So these are some of the recommendations that came out of the evaluation. The full evaluation report link is in the slides that you've been sent. But just to say, the findings challenged the growing trend to communicate just through digital channels, and it emphasised the need for tailored paper-based resources to be sent to older adults during national restrictions. The Keeping Well at Home booklet also showed the value of working with older adults from the start to make sure that the content and the design were inviting to the readers. So both the evaluation and the positive response to the booklet helped secure funding for the combined authority to update the booklet for the winter. So the Keeping Well this winter booklet was launched, and the additional funding allowed for this version to be produced in a number of formats, as a sound file, as an easy to read version, plus it was translated into a number of languages. And findings from the evaluation fed directly into the new version, so some topics that people felt were missing from the first version were included around fire and home safety and frauds and scams. So you can access all of the information via that link in the slide. So all in all, both booklets have been a huge success. And I want to try and play this video for you if it will work. This is one of 2 videos that have been commissioned around the campaign. And this one really highlights how the campaign came together in Greater Manchester, and particularly focuses on the value of having older people at the heart of the work that we do. So I'm just going to play this and keep my fingers crossed.
Just before national lockdown, I convened a meeting of the local lead officers for ageing in the 10 local authorities, really to understand how at a Greater Manchester level we could best add value to the work they were doing, to hear what the needs of older people were and what resources we could find and share.
We were listening to people's experience, what was happening across the city. And we started to really think, how do we ensure that people stay well at home? What do we need to be doing? How do we need to change the story that was maybe coming out of central government? How do we need to make sure that the communications that we're using isn't just digital by default, but is actually more inclusive?
We were lucky because down to the relationship that we've had with the University of Manchester and the Healthy Ageing Group, we were able to combine, I think, the expertise from the academy with the networking and convening powers that we had.
In consultation with the Ageing Hub and other partners, the university decided that we could do something a bit more practical to support people at home and get a paper resource into people's hands as so much information was coming out.
We were getting intelligence and offers of support and need, which would help to shape what this booklet might look like.
I was asked what sort of issues were significant to our residents, what sort of questions they were asking our frontline staff. So we talked about things like helping with repairs, welfare issues and issues of loneliness and isolation.
From partners at the university, it was very clear that there was information that they could share around falls prevention agenda, and that was very much evidence-based. We also had partners at the GM Nutrition and Hydration Programme, and we also had partners at Greater Sport who again had more information on the exercise and how to stay fit.
Some of the content that we supported with is the strength and balance messages. We know that that plays a big part in terms of deep conditioning, so making sure that they were part of the booklet was key for us.
All the people, they knew what they were talking about. So it was good to get information from them.
It's one thing as a policymaker to deliver what we think older people want, but that maybe doesn't reflect what it is in actuality that older people do want.
I just thought this is fantastic because older people, COVID, we are indoors, we were constantly having negative communications via the media, and it was all a downhill. What are we going to get to give us some kind of positivity? And I just thought this was brilliant.
This book is good because it doesn't negate you. This book is like a silent friend.
What made the booklet such a success is the fact that it's co-produced with older people.
The Keeping Well at Home booklet became a World Health Organization case study, which really put us in a position of being an example of best practice globally.
It was really important to us that not only we created the first version of the booklet and we included older people in that, our experts by experience, but then we needed to check that and say, actually, have we done the right thing? Have we included the right content? Does this really make sense to people? And of course, what have we missed? Because inevitably we will have missed something.
Evaluation is critical because in reality, we all live in a bubble. Evaluation is a clean set of eyes.
A lot of the evaluation showed that people really liked the booklet and that they would like other things to be involved in it.
The evaluation of the first booklet gave us a business case for doing the second booklet, and that resulted in printing 140,000 copies of the booklet. It also resulted in being able to produce a video and a talking tips guide.
I was approached by the Greater Manchester Aging Hub to have a look at the booklet and to look at the content, but to also look at the talking and conversation tips that were a guide for people utilising the booklet, so that if you were a frontline worker and you were talking to older people, then you had pointers, tips, ideas, hints, that kind of thing, in which to introduce both the booklet but also to expand on what was in the booklet.
We needed a couple of translations. I think it was Urdu and Bengali, and we also looked at two other translations in terms of British Sign Language, and the easy read version that came from learning disability communities. But what that enabled us to do was kind of simplify and get to the essence of some of the information. And that then becomes something that you can pass on to other communities where there might be difficulties in kind of comprehending the full, more complex and perhaps even sometimes more technical information.
All of this wouldn't have been possible without a successful first booklet, evidenced by University of Manchester evaluation and consolidated by a case study with the World Health Organization.
We've got just shy of 1,000 people that we could literally, the books arrived, the envelopes were ready, they went in the envelopes and they went out.
In Rochdale, we've got them into the vaccination centre, so not only do the older people get a jab, which is fantastic, they also get the Keeping Well in Winter booklet.
In Greater Manchester, we started from a very strong position. We had existing relationships with a wide variety of partners that we could easily pick up. We already had partnerships with the University of Manchester, as well as close working relationships with the 10 local councils that make up Greater Manchester. We also were working in partnership with Age UK, with some housing providers and with some older people's groups.
There is an ageing hub and there is proactive work in older people as a priority of the combined authority. That's also helped by having an older people's network, both for Manchester and Greater Manchester, where you can draw on the experience of older people to make sure you're getting it right and you're doing it with people, not for people.
Because I'd been so involved, I sort of had a bit of ownership, I think, of it. I particularly saw myself as a partner in this, not as a you and them. I felt very much involved and that our contribution was taken on board.
Manchester in particular has a really great tradition of working together across the age-friendly agenda. So, linking people together, bringing partners together so that you've got people from health, housing, social care, the voluntary sector, policymakers all working together to try and make sure that we make Manchester an age-friendly city.
There is a willingness to give up a little bit of an individual organisation or your individual skills to share with other people and to sort of work together.
You're always a little bit worried when you print something like this. And bit by bit, start picking up information. You see photographs outside sheltered housing projects where people are holding copies of the document. The document is being given out at vaccination stations where it's been said to do so. You get information back from local authorities in parts of Europe and the other side of the world saying this is a brilliant product. Can we adapt it? All those different ways, they count as successes, I think.
Okay, so hopefully you could all see and hear that. I'll stop sharing my screen now. I'm happy to answer any questions, or if you've got any questions for Jane as well.
Thank you very much, both of you, for the excellent presentations. And I thought the video was absolutely terrific, and it worked. It worked, thank goodness. So we've got quite a few questions in the chat. So I'm going to ask those questions on behalf of the people who've posted them, because I don't think we've got time really to go backwards and forwards. If I could ask you both to be quite brief in your answers so that we get through the questions, that would be fantastic. Annemarie, by all means, switch your video back on. As well as Chris has already. So there were some comments from Marion really early on in the chat about digital exclusion really, and about an informal survey she's done in Tameside, where carers and people living with dementia didn't feel comfortable in using an app. And I guess, you know, so much is going to influence the extent of digital exclusion experienced by people. So I think that's a valuable comment there, rather than a question. Jane asks...
I would agree with it. We would agree with it. It's a really important.
Jane asks whether there are any findings or details on the use or availability of the app within settings like GP surgeries, pharmacies, for those people who don't have their own IT access but could access the app elsewhere. Have you got anything on that?
We did a review of digital inclusion of older people more generally early on within the PRU, specifically looking at access to general practice services, and essentially found that there isn't a great evidence base for using these things to help older people get access to general practice services. I don't want to go as far as saying it's a barrier, but it was very problematic. So no, there isn't great evidence to say we should be doing this in general practice. Okay. But of course, it may well be the future, given where we are. Yeah. Just to go back to the dementia issue as well, we also produced, as a PRU, some leaflet-based things for people with dementia. So that's on the PRU website. If it was Marion, wasn't it? That was the question.
Thanks, Chris. That's great. Rory asks whether there's much by way of apps and I guess research on exercise that's more about improving cardiorespiratory fitness than the strength and balance stuff. Yeah. So I know you're primarily interested in falls, and that's the strength and balance thing, but what is there on cardiovascular fitness for older people?
I should have said, for the first review of reviews, that was very generic activity promotion and the reduction in sedentary behaviour, rather than just about falls. I mean, the two things are connected. So we didn't assess the health outcomes, we assessed the apps and their ability to get people active. And so there is quite a lot of evidence there in various apps for getting people active with the resulting health outcomes, health improvements, one would hope, for cardiovascular health, mental health, etc. So yes, it's out there, Rory, and look at the reviews which we've done.
Great, thank you. So a question from me that sort of follows on from that, really. So to what extent is exercise for falls prevention different from general strength and balance training? And is the falls element maybe a bit of a red herring that might lose people or put them off if they don't think, well, I don't need to prevent falls, I'm not at risk of falls, but actually we could all, but as we get older, definitely me included, benefit from greater strength and balance training. So I'm just wondering if it's better to sell it as an overall good for health rather than...
You're completely right, actually, Nicky, and that goes back to work we did coming on 2 decades ago, which looked at how we promote those kind of things to older people, and that was actually published as a booklet by Age UK, and don't mention the F word. So get people active, but you don't have to say falls. So absolutely. And so although I was talking about falls, these things are not promoted as falls prevention towards the end user, if I can put it that way. They are much more likely to be activity promotion, improving strength and balance. What you should say is that to prevent falls, there are very specific levels of exercise you need to do, which do relate to your strength and your balance, rather than just going for a walk. So although we talked about walking earlier on, there is no evidence that walking actually prevents falls. In fact, it's a bit the other way round, that simple walking can be related to more falls, but that makes sense because you're kind of every step you take, you're at risk of falling down, as it were. But yeah. Don't want to make too much of that.
No, that's great. It's fascinating stuff. So, and Chris has put some good links in the chat for other resources, by the way, so please do look. Judy Collins just mentions, and I think this is another cause for celebration, that the Greater Manchester, is that Older People's Network, OPN, won a COVID award at the University Patients and Public Involvement and Engagement event yesterday for keeping well at home. Thanks, Annemarie and Jane, says Judy, so that's lovely. Rory asks us another question about Anne-Marie's presentation and whether there's any scope of expanding the outreach of the booklet, getting it into GP practices, hospitals, clinics, to increase physical activity amongst elderly people. So greater, wider dissemination of the booklet.
I'm not sure exactly. Jane might be better to answer that, but I know that the booklet has been taken into care homes, and that the exercise sections were being used in care homes. But yeah, I mean, there's obviously scope for them to. I can see Jane's just come in. Did you want to add to that, Jane?
Yeah, just to add that actually there's been some really innovative use across the UK of how the booklet's been used from reablement teams, hospital discharge teams, but I completely agree it's more just an issue of resource for the next round of funding and maybe a slightly adapted version again, but I think there's lots of really great ways that it's been used that have kind of gone outside of our expectations too.
Thank you, Jane. That's great. Nice to see you. Hello. So nice comment from Beth Mitchell in the chat, who just saying she loves the video. What a fantastic piece of work. And then Marion asked a question about the challenges we have to recover mobility and activity that's been lost, and any plans to get something underway there. The loss of these things under COVID, including confidence, and how do we help people to get those back?
That's absolutely an important question. In fact, it's one that's there's a lot of discussion going on within the NHS and within the Department of Health about how we now start to promote activities and provide the resources and provide the resources for this to become a reality as we come out of COVID. Out of the current version of COVID, maybe I should say. So it's absolutely in discussion. It's absolutely right up there at the top of the agenda. At least we believe it is, and we're pushing it very hard.
That's brilliant. Right, I'm going to have to speed up now because there's lots more questions to get through. A question from Judy Collins: does social prescribing have a part to play in delivering this kind of thing from GP surgery?
Yes. Quick answer.
Yes, short answer. And I should say that we've got a lot of work in the applied research collaboration in GM to evaluate social prescribing. Then Jane Brooks, hello Jane. How do we get a copy of the booklet to send to our own older family members?
It's downloadable, but I don't know where the proper printed copies are these days.
I think the combined authority do have some additional copies, but you can download it. We did it so you can download it as well. So it is downloadable from the website. You can just print it off if you want to give it to one or two relatives rather than large numbers. But they were distributed across all the local authorities, all 10, and they've used them in different ways at the moment in vaccination centres, as noted earlier.
And I'm sure Jane Brooks isn't digitally excluded, so I'm sure she can print copies of family members and pass them on. I think actually that we're about 4 minutes shy of the end of the session, and that's actually the rest of the messages were kind of congratulatory, which is lovely. I just wanted to end with a final question. There's been a bit about exclusion in this, and I just wondered if we've done much work looking at the effect of educational, years of education and other socio-economic variables to see what the relationship between those are and ability of older people to engage with apps. And
there was some really nice work done using the ELSA database by James Nasru and people over in Humanities, which looks at older people's access to the internet. It uses the internet as the proxy for digital. And it clearly shows that there are cohort effects, meaning people in different age groups have different effects. So the oldest group have the least digital ability, and the younger, older groups have the most digital ability. But then there are relationship with gender as well, and marginalization, poverty, if we like. So if you are an old woman from an ethnic minority living in a deprived part of Greater Manchester, for example, with poorer education, you are much more likely to be digitally excluded than even her male counterpart. And as they get younger, it's a sort of clear dose, dare I say, sort of dose-response relationship going on.
And
very
so
clear.
For those of us trying to deliver information in that way, are what from that then to try much harder to support, to target?
There's a lot, actually, it's beginning to be, we're about to start a project on this, looking at how we can, well, what we can understand about what's happening across Greater Manchester and what we can do about it. And clearly there are, there are resource issues, so actually having access to the kit. There are technical issues. Can you do it? Do you know how to use the stuff? Are you being supported? And then there's actually, bizarrely, technical issues relating to the availability and how good the internet is in your area.
Yeah. Okay, no, that's great, Chris. Thank you so much. James very helpfully put the link to the booklet in the chat, so you can get the link from there. For those of you who are registered for this seminar, the slides are available. I just want to thank you all so much for coming and for the lively chat. And thanks for two excellent speakers. And I should know what the next seminar is. I don't have information at my fingertips, I'm sorry, but keep your eyes posted. It will be on the peeled rather, keep your eyes posted, keep your eyes peeled. The next one's on the 28th of July, and we will be posting information about the topic for that seminar. So I hope you can all join us again. Thank you very much, everybody, and goodbye.
Yeah, thank you so much, and thanks to the team who put this work together behind Healthy Aging Research Group and Healthy Aging Research Team. Thank you.
Thank you.